Without further ado, let me introduce our first panelist, Dr. Mark T. Agrama from Palm Beach Sleep and Sinus. He's a board-certified expert in nose and sinus surgery with 10 years experience performing balloon sinuplasty and the developer of Breathe Naked Repair. Please welcome Dr. Mark Agrama.
She did say breathe naked.
Next up, we have Dr. Enrique Gongora, a board-certified cardiac surgeon. He leads the adult cardiac transplant program at Memorial Cardiac and Vascular Institute. Now, since launching the program in April of 2014, Dr. Gongora and his team have a 100% survival rate with transplant patients. Please welcome Dr. Enrique Gongora.
John C. McGuire, Clinical Director at Futures of Palm Beach, leads a multidisciplinary team of addiction treatment professionals, providing individualized care for those who are battling addiction while addressing the emotional issues that drive addictive behavior. I'd like you to welcome John McGuire.
And completing our panel is Dr. Paul Roubal, inventor of the Smooth Operator Cellulite treatment, a dedicated student of anatomy since 1975. He combines his education with his passion for research, and his most recent contributions to the scientific community focus on reducing the appearance of cellulite. Please welcome Dr. Paul Roubal.
In Istanbul, I'm Turkish.
Nasılsınız?
Thank you.
They're rushing the stage.
You're a rock star. What can we say?
It's like a mosh. We're going to dive into the mosh pit.
Well, now we will hand it over to you, Dr. Oz, and to our panel.
So these are probably, if I had to pick 4 areas to speak about today, because they're both diverse, but they're also common, I would pick these. So we're going to talk about the heart, your sleep and your sinuses, addiction that I touched on briefly, but it's a crisis level in America right now. And we're going to talk about cellulite, which I know everyone in the room cares about. Who cares about cellulite? Yeah. 95% of women have it, and women worry more about it than we do, right? But it's an issue. All right, let's talk about Dr. Agrama. We went to Jefferson Medical School, which is where my father's a professor. My dad's 91 this year. So if you're associated with Jefferson, you live long and prosper. So let's talk a little bit about sinuses, if you don't mind. And it's an issue that comes up a lot because people don't even know if they have sinusitis. So help them understand when they have allergies, when does it become sinusitis, and how do you know what the cause is?
Thank you, Dr. Oz. Pleasure to be here. Sinuses, we all have sinuses. And when the sinuses get full all the time, pain and pressure, congestion in the nose, we have symptoms like cough, postnasal drip, headaches. These are common problems. And well, what are the sinuses? The sinuses are air-filled cavities inside of our face. They're inside the bone. So if we think of them as rooms connecting with little small hallways into the main lobby of the nose, air should be flowing through there, and it should flow clearly, mucus should drain clearly, and we shouldn't have problems. But when people have this congestion, pain and pressure, what's happening is things like allergy, viruses, cigarette smoke will kind of clutter the hallways. So now things are getting tight through there. You can't get into those rooms. You're trying to get through the lobby? No. Fluid, mucus, and phlegm, it'll fill into the room. And then that's when the bacteria or the fungus or all of the above will jump in there, and you get pain and pressure, and that's what we call sinusitis, inflammation of the sinuses.
So what are the treatments that you find work most effectively? And when do people actually have to go see a professional?
Well, you don't have to start with seeing a professional. Simple things like concentrated salt water, breathe strips, nasal sprays, allergy therapy are all helpful. And then you may see the doctor and they may give you an antibiotic. But so often, that's really not enough. And one of the things I am really happy to share with people is this concept of opening these hallways into the room. And we do that with a procedure called balloon sinuplasty. We're really happy. Actually, last month was a 10-year anniversary of balloon sinuplasty. It seems like a new thing, but what we're doing is opening those hallways. So with a simple procedure in the office, that's our default now. We've gone from major surgery to office. We pass a wire through the nose, through this little hallway into the room. Over the wire, we pass a deflated balloon, and after it's all numb, and maybe a little bit of a sedative, in about 1 second, we open the balloon, and that hallway's open. We take it all out, and we have permanent relief from the sinuses. The nice thing is, there's no general anesthesia, low risks, a little bleeding, infection, and maybe the need to do it again. I'm proud to have done this procedure for 10 years. I did 2 of the very first awake procedures in this country that year in 2006, and we've done thousands of sinuses since then. Balloon sinuplasty can help keep the sinuses open.
Nicely presented. If I get Dr. Gora. Dr. Gora, again, I do a lot of heart transplants at Columbia, but they have a 100% survival rate is a real feat. Could you explain to the audience a little bit about what heart failure is, the condition that leads you to have to perform transplants and other reparative operations to keep people from dying from an ailment that afflicts so many of us?
Thank you very much, Dr. Oz. Thank you for having me here. Well, heart failure. The heart is a pump. The heart is a specialized muscle that beats 60, 70 times a minute, and it will beat about 3 billion times during a patient's lifetime. When the pump doesn't work, the heart is not able to move enough blood flow to deliver oxygen to the tissues, so the tissues can do their job. So heart failure means that the patient has a weak pump. Heart failure itself is not a disease, it's the end result of multiple diseases that can affect the heart. It could be the coronary arteries, the arteries that give blood flow to the heart. It could be the valves that are affected, they may be obstructed or they may leak. It could be diseases that affect the conduction system, the electrical system of the heart, or it could be diseases that affect the muscle of the heart itself. The end result is that the heart has lost its ability to pump sufficient blood. When that happens, then the body tries to cope, and it copes by retaining fluid, and the heart copes by beating faster and enlarging some. But this helps for a while, but then it actually becomes damaging to the heart as well. So when the heart cannot pump, pressures inside of the heart increase, and pressures in the whole vascular system increase. These increased pressures actually lead to what the symptoms of heart failure are. Those symptoms are chronic fatigue, inability to tolerate exercise. Patients start having shortness of breath with exercise, and then is with mild activity, and then even at rest. Patients can also develop edema or swelling of the lower extremities, and in more severe cases, they can actually retain fluid within their abdomen and within their chest. So patients are severely limited. In the end stages of heart failure, patients will succumb to heart failure and die because of it. There's 2 main reasons why people die with heart failure. One is because they develop a ventricular arrhythmia, which is what most people know as sudden cardiac death. And in a second, the heart loses its ability to contract, and it develops a disorganized rhythm, and the patient just passes away and is unable to be supported. Other patients just die of lack of chronic blood flow to other organs. These organs tend to fail, like the kidneys and the liver.
I don't know how many of you remember this, but when President Eisenhower had a heart attack, who remembers that when that happened? Like 7 people out there, all right. So this is the mid-50s. They put him on bed rest for months. He was in Colorado, higher altitude, less oxygen in the air, maybe, whatever reason, he had a heart attack. And that was all we could do back then. That has changed a lot. So if I can ask my panel to speak loudly just so they can hear you up in the raft, you have a standing room audience only. So they're be honored by that. Explain what we can do today to treat the heart failure that threatens the lives of millions of Americans.
Well, appropriate treatment of heart failure starts with patient education. The patient must become knowledgeable about their disease so they can become their own best advocate. Patients have to have nutritional changes. They need to be able to limit their salt intake. They also need to be able to limit the amount of water that they take so that they don't swell up. Then they are placed on different medications in order to help with heart failure. Some of these medications are called diuretics or water pills. Other medications just indirectly improve the efficiency of the heart by decreasing blood pressure or improving heart function somewhat. But heart disease itself, heart failure is not a disease, is the end result of a disease. So if a patient has a blocked coronary artery, they need to have that artery either treated by stenting or bypass. If a valve is severely damaged, that patient may benefit from surgery to repair or replace the valve. If the patient has a rhythm problem, sometimes they have to have ablations in order to be treated. Most patients with advanced congestive heart failure actually will have a defibrillator placed to prevent sudden cardiac death. Some patients actually may benefit from having a special type of pacemaker to improve the synchrony of the heart. So it works in the top and the bottom chambers work in a better fashion. But as time progresses, the disease will progress and patients will enter what is called advanced refractory heart failure, in which medications do not work anymore. And these patients can be rescued by either heart transplantation or implantation of a mechanical device inside of the heart to help move enough blood flow.
So what you're hearing is good news, because it means instead of being fearful of a diagnosis that used to be a death sentence, it's the opposite. The same is true for a lot of cancers now. We don't manage cancer that well in America, but when it's managed well, most people survive. We're becoming a country of survivors with chronic heart failure and cancer therapies being at the vanguard, but there are many others that are coming. But one area that's really hurting us a lot is the opioid addiction that I spoke to earlier. I'm gonna ask John McGuire to help us with this a little bit. I think everyone knows about the pill mills that are being shut down in this area. What most people don't appreciate is the connection between the opiates that a doctor gives you and the heroin you end up on. I used that word moral, that phrase moral failing before. We think it's just people that are lost their way. 1 in 3 American families is influenced by this now. And I'd love, as an expert, John, if you could share with the audience some of your insights about how that rapid movement towards street drugs is occurring and what we can do about it.
Thank you very much, Dr. Rouse, for having me address this issue. It is a crisis in our society. And as you pointed out, in Florida, we have addressed the pill mills, but I believe it even goes beyond those pill mills. I think it goes into our community, not just in Florida, but throughout the entire United States. And the issue is, I break down into two issues or two areas. The first being that the prescription of those opiates. When a person gets those opiates, they are supposed to be on it for a short period of time, but unfortunately, that dependence that they build on, not only is it physical at some point, but then becomes psychological. And that psychological and physical dependence is very difficult for them to break. And unfortunately, what ends up happening is that prescription does not last for long, or the doctor does end up not giving them the prescription. And then what happens is the individual who now has this addiction to the opiates has to seek it out some other way. And a lot of advances have been gone on where doctor shopping has stopped because of a database that's being developed. But the issue is now the individuals turn to the streets and they go seeking the same pills they were getting from their doctor now on the streets. The unfortunate thing is, or the problem is, those pills are very expensive on the street. Yeah. And the unfortunate item is that heroin is very, readily available and is rather inexpensive. And the problem is now the individuals who have needed this drug because they were using it to fight against the pain that they were having, their life is going from a fight or flight situation to now it's a live or die. And they have the feeling, if I do not use this drug, then I feel like I'm going to die. So the unfortunate, now you've moved into a person who's gone from that prescription to something buying the street drugs. The second situation I've seen, and I think it's more of a cultural shift. Years ago, older generations, even though there were other drugs out there, heroin was something that was taboo, never went by it. And I see in younger generations, especially at Futures with the younger generations, they do not look at heroin the same way that older generations look at it. They don't look at it as detrimental or as lethal as it was once before. They appear to have less fear of it. And with that mentality, they're turning around and utilizing that drug to help them cope, not just for the pain, but to help them cope with emotional pain, the physical pain, emotional pain, and even spiritual pain. And unfortunately, due to those situations, the increase just keeps going higher and higher. And as you said before, it's not immoral. These people are not, it's not bad people that need to get good. It's sick people that need to get well.
Yeah. But could you put your hands up if you know someone personally who's had a problem with drugs or alcohol? Yeah. I mean, it's more than half the audience. And thank you for being honest about that. Give folks hope. What are the chances that if you're an alcoholic, you'll get sober and stay sober, or you'll get off your opioids and actually stay off them? What's the long-term game here?
The long-term game, and we as humans are very difficult, complicated animals. And the same thing is with recovery. Everybody's gotten into their recovery for a different reason. But the one thing that we see at Futures is that it's not just addressing the addiction. I mean, that's abstaining from the substance to me is not recovery. What you have to do is look at life. It is finding a balance in life. And I know when folks come to Futures, we address it as such. What we see when that addiction, we see the top of the iceberg. We start looking at what's underneath that iceberg. Is it depression? Is it anger? Is it anxiety, self-esteem, some trauma that they've experienced before that they've turned to the substances to actually comfort themselves? But so we turn around and look at that and say, okay, how do we address life? We're looking for that balance in life. And one of the approaches we utilize at Futures is dialectical behavioral therapy, better known as DBT. And DBT focuses on 4 aspects. One of them is distress tolerance. We're helping individuals learn healthy coping skills and how to deal with situations. We all have problems in life. Life is going to be full of problems, but if they have a healthy way of approaching it, that will help them. One of the biggest issues we see is with anxiety, and we teach people how to turn around and at some point accept their anxiety, but not that they approve of it, but to come around and utilize some healthy coping skills to deal with it. Interpersonal effectiveness is another issue that we deal with. We all have relationships. We're animals that like to be gathered. We need connections. So it's interpersonal relationships and how to communicate in a healthy manner, being able to express ourselves and let people know how we feel. And then there's emotional regulation. Especially when individuals come off substances, there's a lot of emotions coming around, the anxiety, the stress that they feel. And to help them identify how to address them, how to express that, and how to utilize, as you mentioned before, the meditation, the hypnotherapy. And I think the biggest component within DBT is mindfulness. It is being able to utilize and be aware of what they call the wise mind. It is realizing that you have emotions, but you also have some rational thinking too. And it's being able to stay in the moment. One of the things I see most often in treatment is that people, I call them time travelers. They're looking in their past, they've seen what they've gone through, and they have a lot of guilt and shame about it, but they're also very anxious about the future, what's going to be next. So they're not living in the present. And what happens when we utilize mindfulness, it's being aware of living right here at this moment in time. And it's very difficult for some folks to comprehend that.
Beautifully described. Let me now turn to a topic I know you're all waiting for, cellulite. Dr. Paul Roubal has been a pioneer in this area, and I know so many people are caught up in the idea that they don't like what their thighs look like, and they don't know what they can do about it. They buy creams on the web. Please, by the way, please be careful about stuff you buy on the internet. You all know that they're fake products that take advantage of not just my name, Suzanne Summers, who's coming out, had her face and image used. I got an email from Barbara Streisand. She was on a show with me last year, and they took her picture, and they claimed that I made her 25 years younger, which she looks great to begin with, but you can't do that with a cream you can buy on the internet like that. And people buy them, they get upset about it because it doesn't work, because it's nothing in there. So be thoughtful about that. So Cellulate's probably a classic example, but there are things that do work. So help the audience understand a bit more about how to evaluate cellulite, how do they move past the shame sometimes associated with their thighs look like, and then I'll get into what you can do to help them actually truly look different.
Well, I think one of the big myths about cellulite is that people believe that if you're overweight, you have cellulite. It's not true. We know that. Cellulite is not caused by obesity or being overweight, but it can cause embarrassment even in the fittest of women. And I see that all the time. And it's something that we really need to look at, because 80 to 90% of all women have some form of cellulite.
Say that again. What percent?
80 to 90% of all women have grade 2 to 4 cellulite. Grade 1 is none. Most men don't have it, but that's related to anatomical differences in the subcutaneous tissue.
80 to 90%. So stop being embarrassed about it because the person to your right and to your left has it too. All right.
Yes, I agree with that. And one of the big things is it's not just physical, it's emotional.
Yeah.
Very emotional. We did a study, took a year and a half, had a large group of people, and we found that the vast majority of people that had the cellulite in the study didn't like the way they looked, but were very emotional about having the cellulite.
So what do you do about it? I mean, people don't like the way it looks. They have to get past the emotional part about it. What's on the cutting edge for us?
Okay, here's a couple of things people really need to know, and I know you talk about this in your show. Thank you for having me here, by the way. And I know a lot of your fans talk about cellulite. I know that's an issue you bring up often. Cellulite is a cosmetic problem. It's not a medical problem. So a medical problem you take care of with maybe a medication, insulin for diabetes or whatever. You can take all the pills you want. It's not going to make cellulite go away. Cellulite is an anatomical cosmetic problem. Number one. For people that have cellulite, women that have cellulite, and they're concerned about it, there are treatments that are available that do work. They need to take a look at those treatments. They need to work at what kind of treatments they are and look at what they're affecting. And subsequently, we can take care of not only the physical, but what I consider a very important part, the emotional aspect of cellulite. Over the last 10 years, importantly, there's been a lot of research on cellulite. And if you look at the peer-reviewed journal research, there's 4 things that need to be addressed. And I know you talked about them. One is reducing the septae and breaking them down so that they're not as strong. They're responsible for creating the dimpling, and the stronger they are and the tighter they are, the stronger the dimpling is. The septae actually have fat.
Yeah.
That's why women store fat in their thighs and their fannies.
They're all nodding their head. Like
Yeah, you don't get it in your head, you don't get it in your stomach, your thigh and your fanny. The second thing you want to do is you want to take care of the skin. So we want to get the skin more elastic and thicker. That's the second thing. The third thing we want to do is we want to increase the circulation and the lymph flow, which is very, very important.
I don't know the fourth thing.
You do know the fourth thing.
I forgot it if I did know it.
Oh, and reduce the fat.
Oh, well.
The
That's the hard
sub-Q
part.
fat. Of course, I'm last, so I get to listen to all these great guys, and of course I'll forget something. Now, those 4 things are treatable by a few different things. And one of them I will mention is cellulase. And I know you know about it.
Yeah.
It's an invasive procedure, and it's expensive. And I worked very hard the last 8 years, and it all started with a very small project based on a 35-year-old woman with an ACL reconstruction that came in, great shape, and said, "You have a degree in anatomy too, don't you?" I said, "Yes, I do." She said, "Look at this. All right, you got cellulite. Figure it out." So 8 years later, here I am.
So let me ask you one last question, because I do appreciate you all coming here. Give me one self-test we can all do now. Let's start with sinuses. Show people how to examine their sinuses for sinusitis. And then I'm going to ask, what's the right heart rate for us to have? And one question to ask ourselves about addiction to see if we should be worried, and how to tell between grade 2 and grade 4 cellulite. All right, take it away. I'll hold the mic for you. Show them how to do an exam. Oh.
So one of the exams, and invite everyone to come to our booth, we can show you how to do it exactly. But just inside the nose, the nostrils and the turbinates are blocked. And for a lot of people, they have no idea how blocked it is. And what we've been doing all day is showing people, we take 2 Q-tips, and we gently dilate the nose open. And a lot of people think they can breathe and may not breathe as well as they could. And some of the expressions that we have, I call it the nonverbal effect. Your brain knows it before you do. And if that's the case, that could be the key. So the breathing through the nose leads to the sinuses. Actually examining the sinuses, we require endoscopy and looking in and so forth. But
if you get pain right here on your cheekbones or right above your eyes like that, those are the classic sinuses and the ethmoids as well here, I guess. If you feel pain there, you need to see someone who can help you.
Thank you, Dr. Oz.
Heart rate. People can sit there right now, show them how to get their heart rate, and then give them an idea what it should be if they're in good shape.
Well, to obtain your pulse, you should grab your index and middle finger and place it on your wrist.
Do it like this, guys. You see my wrist
Just like
and the
that.
cameras?
And you can actually feel the radial artery. And that is, if you feel it, you will feel the pulsation. And then you just have to count how many pulsations do you feel over a 15-second period, and then multiply by 4. It will give you your heart rate, beats per minute, and then it should be about anywhere between 60 to 90 in patients that have coronary artery disease, and in patients that have heart failure. Actually, we try to keep it in the 60 to 80 range.
But if it's right now over 90, either you're very excited about what you just heard, or you might be concerned. Your heart rate should not normally, when you're resting, be more than 90. And when you do this little exam, don't press down too hard. You'll actually shut off the blood supply, and you can't measure your pulse that way. All right, one question we could ask ourselves or loved ones to see if we're having a problem with an opiate, alcohol, or anything else.
Well, one thing I'd turn around and ask a person to look at is, how is your substance or alcohol use impacting your life? Is it impacting the relationships? Are you cutting back on life? Are you turning around and having difficulty at work? That's one of the important things. But I also like to say to the families, because many people raise their hand, is I would ask them, how are you taking care of yourself? It goes back to the old flight attendant theory. You have to put the oxygen on yourself first before you can help somebody else. So please make sure you're taking care of yourself and you're doing what you need for your mental health and physical health before you're trying to attempt to help somebody else.
Thank you, Dr. McGuire. Dr. Roubal, how do you know if it's bad cellulite or just average cellulite?
Okay, I'm going to stand for this if you don't
Please.
mind. Okay, so we have me, Paul. I'm a man. I have no cellulite. I'm not going to show you. I don't have any, okay? A woman that has no cellulite, no matter what position she's in, no matter how she contracts her muscles, no matter what activity she does, she will have smooth skin through the thigh area and the buttocks. And I just want to show one thing here. Grade 2.
I thought you weren't going to show it to
No,
us.
I can show you something. So grade 2, I'm in a restaurant and I've got a lovely woman with me, my wife, let's say, and she's got a mini skirt on, and she folds her leg over. The fascia underneath the skin
Flip
will
your
pull.
leg so they can see it on that side. No. Oh, my goodness.
Thank you. Oh, here we go. The fascia underneath the skin will cause some dimpling. The other way you have a grade 2 is if you pinch and you get dimpling. Grade 3,
Pinch back here. Like
yeah,
that.
pinch back here and you'll see dimpling.
All right.
Pinch right here. Grade 3 is if you contract the muscle standing, just contract the muscle, you will see dimpling. Grade 3. That's generally the case. Grade 4 is what we call cottage cheese. You stand up and you've got dimples and they're there, and it doesn't matter if you're contracting, you're doing anything, that's grade 4. In our study, 75% of the people are grade 3 and 4. So people with grade 2, a lot of them don't really worry about it. More people worry about cellulite, and I think Dr. Oz would say the same thing, when they get to be about 40 and they're divorced and they're going to start dating again.
Yeah.
Or they get a little older and they say, you know, I don't like the way I look. But it has nothing to do with weight.
Thank you. You guys have been absolutely wonderful.